What's up, guys? It's that time again. Happy hump day. This week on Over the Hump, we're going to be going over low back pain, specifically lumbar instability. There are so many different types of low back pain. It just didn't seem right to try to break them all down into one video. So within lumbar instability, we're going to go into structural and functional instability. I'm going to talk about some signs and symptoms to help you decide maybe if that's what's going on for you. And then if it is, we'll be breaking down some different exercises and techniques to hopefully help get you over the hump with that issue. Low back pain is one of the most, if not the most common thing that we treat in physical therapy. It's super prevalent. Pretty much everybody has either had back pain or knows someone that has had low back pain at one point or another. There are a ton of different types of it, but lumbar instability is the one I wanted to focus on today because it's a part of most different subgroups at one point or another. When I say lumbar instability, there's two main different categories that I want to kind of go into. The first one is structural instability. This would mean that you have like a fracture in the vertebrae, specifically called a spondylolisthesis. It could be an anterior listhesis or a retrolisthesis, meaning that there has been an actual shift in the vertebrae, forward or backward, or it could simply be a spondylolysis, where there is a crack in the vertebrae structure, but there's been no actual shift occurring. These would all be considered like structural instability because the actual vertebrae itself is what is unstable. Functional instability is when there is more of an issue in the control system of the vertebrae, so the muscular, like the deep stabilizing system. All throughout the body, we have systems where there is a movement system and a stability system. If you think about the shoulder, we have the deltoid muscle on the very outside that moves our shoulder around. If we go deep to that, we have the rotator cuff, which just stabilizes the ball inside the socket. And then if we go deep to that, we have like the ligamentous layer in the shoulder capsule. So for me, working from the inside out, we have a passive layer of stability that's the ligament in the capsule that is non-contractile. Then if we go out one layer, we have that contractile stability layer like the rotator cuff. And if we go out all the way to our movement layer, we have the deltoid, and that's just responsible for moving us around. We have that system all over the body, and the spine is no different. We have at the base layer, we have the vertebrae adding some stability, but then we have ligaments. We have these big, thick ligaments all the way up and down the spine that give our spine a lot of stability. Just outside of that, we have a group of muscles that are the stability muscles of the spine that function just like your rotator cuff does for the shoulder. They are responsible for this segment by segment mobility of each vertebrae moving on the next as we go through our larger movement patterns. Those larger movement patterns are responsible or carried out by our movement layer, which are those lumbar paraspinals, those big long muscles that run up and down the back. Those are the ones that are responsible for us bending forward and backward and rotating like our obliques are. But if you go down, there's this whole layer of stability muscles, namely internal oblique, transverse abdominis, pelvic floor, diaphragm, and multifidi are the five that I kind of think of as like the stability layer. You could certainly pick on a few others like quadratus lumborum in there and things like that, but those are the ones that are really going to be responsible for creating that intra-abdominal pressure or for stabilizing that pressure and creating a stable spine during our movement patterns. But they need to be able to control that segment by segment motion in order for our spine to stay in good positions and not have any shifting happening at the vertebrae level during those movement patterns. Within all types of low back pain, there are some overlap in the symptom presentation, but to me, there's three hallmark signs of lumbar instability that I want to see if you can relate to as you're describing your own symptoms. So the first one would be that it's typically better in the morning and worse as the day goes on. You'll typically find that like evening or afternoon time is the worst for your symptoms, and this could be with neck or low back. A lot of these are going to be congruent within anywhere in the spine. The second one would be that you have what's called neutral or mid-range pain, meaning that if you're standing upright, you're doing pretty good, but that as you go outside of that just a little, between what I would consider about 10 degrees of flexion and about 40 to 50 degrees of flexion, that's where your pain is the worst. But actually, if you were to bend all the way over, It doesn't really, it actually gets better. Like your pain's better at the bottom, better at the top, but throughout that mid-range, it's more bothersome. And that's because we don't have the stability in that mid-range of any of our actual structural components. When we're standing upright, we get good alignment and stability out of the bones and vertebrae themselves. When we're bent all the way forward, our ligaments are pulled tight, providing the stability through that deep passive layer. But in the middle range, it's the job of the stability muscles to stabilize us. And when those muscles aren't functioning well, and you can think of tasks like doing laundry or doing the dishes or bending down to pick up a baby or something like that, those are the activities where, oh gosh, it feels like our back's super tight, or we bend forward and we feel like we have to like walk ourselves back up out of that range. That's because those stabilizer muscles are not functioning well to keep those vertebrae stable one on top of the other through those bigger movement patterns. The last main symptom for lumbar instability is that you always feel tight. Tight is different than stiff, and I'm not trying to like put words in your mouth because everybody uses different language with this, but stiffness is more of a joint symptom. Tightness, that muscle tightness that you feel, and you're like, surely I'm not unstable, I feel tight all the time. What's happening is that superficial movement layer, those big long paraspinals up and down your back, when those guys feel tight all the time, it's because they're being asked to do a job that they're not very good at. That's our movement layer. It's supposed to bend us forward, bend us back up, and then kind of chill out. As you go deep to that, the stability layer is supposed to be the one that's sort of acting like a dimmer, and it's on all the time, but to different degrees. Whereas that movement layer is sort of more on or off. When we don't have enough activity in that deep stability layer, our movement layer has to function as a brace all the time and stay tight. So the reason that outer layer is feeling so tight is because the inner layer is not working well enough. So instead of stretching it or massaging it or foam rolling it, the nervous system's always going to keep retightening it back up until you get that deep stability layer turned on to take the stress off of the movement layer. And that kind of takes us back to that first symptom where it's typically better in the morning and worse in the afternoon or evening. And you can also think about the fact that, hey, these symptoms should be better when you're lying down or sitting with your back supported, especially if something is in contact with your low back. Because when there's something external in contact with your low back and it's getting stability through that external structure, like if we sit in a chair with a backrest or we lay down, those muscles of the movement layer, those paraspinals that are too tight and overactive, they get a chance to finally relax a little bit, which takes your symptoms down. So typically in the morning, they're less active than they are later in the day when they've been having to overwork all day to make up for that loss of stability layer. So those are the three main symptoms that are really consistent with lumbar instability, functional or structural. So now let's kind of go into some different exercises to work on addressing each issue. And the cool thing about these exercises is, honestly, guys, they're the same whether you have structural or functional instability. We still need to ramp up the activity of that deep layer. And again, to kind of circle back, some of the main reasons why these muscles get shut down in the first place is just from prior episodes of low back pain. So there's a ton of studies showing out there now that especially the multifidus, which is the muscle deepest in the paraspinal group that probably functions most like that rotator cuff of the spine, that is a significant muscle, that muscle is significantly shut down during episodes and following episodes of low back pain, just due to the pain and inflammatory response of an injury back there. That muscle goes very dormant. It begins to atrophy, means it gets smaller and weaker, and it doesn't always sort of like kickstart back up after that pain is gone unless that layer is specifically trained, which is why so many people are out there walking around with deficits in that particular muscle group. So for folks with lumbar instability, we have two main goals, right? We have to shut down that superficial movement layer to get some of that tightness out of the paraspinals. And then we really need to work towards bringing neural activity or neuromuscular re-education to that deeper layer, to start getting some blood flow in there, to start getting little contractions of those muscles to bring them back on board. So if I'm thinking how to shut down the superficial movement layer, and to be honest, everybody's a little bit different. Some people, you don't really need to shut down that layer. You can just jump straight into the activation exercises, and that superficial layer will just kind of quiet down on its own once the stability layer has been brought, the activity of the stability layer has been ramped up. And you don't really need to even worry about getting those paraspinals to relax. In the clinic, some of the main techniques that I use to get the paraspinals to relax is deep tissue massage. Dry needling is very effective on that. Ultrasound can be very effective on that. Or doing things that artificially bring tone into that, bring stability into that area. Even kinesiotaping can be helpful, but doing some different stretching techniques that bring on the ligament stability can help to temporarily shut those muscles down. Different positions of holds. A lot of times I really like to have people laying on their back with their legs up on a couch and work on diaphragmatic breathing, where the diaphragm is really expanding circumferentially into the abdomen, which actually pressurizes the spine from within and can get those low back muscles to calm down as well. So those are some of the ways that even heat at home, if you're at home using a heating pack, so lying on your back with a heating pack and your legs up on the couch to where your low back is completely congruent with that heating pack in the floor, that gives it good stability from below, and then the heat helps to relax those muscles. So if you're having a lot of problems getting those muscles to calm down, those are some good techniques to start to use. And then after that is when you kind of go into these activation exercises. So for the activation exercises, I'm not gonna like pop in videos of all these because that would take forever, but I really wanna reinforce the fundamentals of them, and then I'll go through a little bit of a list. So big picture wise, these need to be very, very slowly performed. The slower you fire, the deeper you fire in the body. If we go through these quick, we're gonna completely blow past the layer that we're trying to work. They also need to be relatively non-difficult. If we're having to work really hard, chances are we're using bigger muscles in the body. Think about, like, again, the rotator cuff. When you're doing like a side-lying external rotation, you're not like gritting your teeth and going to failure on an external rotation exercise. It's meant to be done at a pretty low level of effort because, again, these are stabilizing muscles. They're not our big, strong movement muscles. So if we're applying a lot of effort, again, chances are we're blowing past these and using the wrong layers. Those are probably the two things, going too fast and going too hard, are the ones that I see people screwing up with the most. When I have them show me how they're doing their stability exercises, sometimes they know some decent exercises to do and they're just honestly doing them wrong. They're like too much. So you kind of do have to do less, and you've got to really tune in. You need to get into a quiet room, not a lot of distractions, and you've really got to focus. It's called neuromuscular re-education for a reason. Like, you've got to have your focus really tuned into those muscles that you're trying to work in order for this to be effective. Another easy thing to think about is that, like, hey, there really shouldn't be a lot of movement happening at the trunk while I'm doing these exercises. Why is that? Well, these muscles are super tiny and they are anti-movement muscles. They're stability muscles. So if we're moving a lot, we're not using our stability muscles unless we're assuming that our stability muscles are at least engaged during that movement pattern, which is sort of the functional goal long term. We want to learn how to activate these stabilizers, and then we want to integrate them into functional patterns. But recognize that if you're moving, whatever muscles you're using to move are not the muscles that we're actually trying to work here. So like something like a bridge or a bird dog, or like a dead bug, right? Those are known to be good stability exercises, but just recognize that none of the movements that are happening there are actually being performed by these stabilizers. These stabilizers are being assumed to be engaged during those movement patterns, but if you have poor activation and recruitment of your stability layer, you're not doing yourself any good doing those exercises. You're just reinforcing your body's learned compensation patterns, which is not helping anybody. So that's just kind of something to sort of check yourself on a little bit and make sure, hey, do I really have good activation of these before I'm asking my body to do them at a functional level? So number one is going to be pelvic rocking, anterior and posterior pelvic tilts. This is where you'd be lying on your back face up and really gently rolling your pelvis backward and forward. When you roll the pelvis backward into a posterior tilt and you're flattening the lumbar spine into the ground, you don't want to be pushing with your feet. You want to be using just the muscles from the belt line to the sternum, and you're gently pulling those together and drawing in at the waist to roll the lumbar spine back into the ground. Those are using all the muscles on the front side. I've also got some cool tips and tricks how to add resistance to anterior and posterior pelvic tilts that I haven't ever seen before. I'll try to get that video posted up sometime within the next week. The anterior pelvic tilt is the exact opposite. Again, you're laying face up, probably with your knees bent. Now we're rolling our tailbone down into the table and actually arching our back. We want to do this very slowly and gently, and this is working on some of those deep lumbar extensors, namely the multifidus, as we go into that motion pattern. So you actually want to feel contractions deep in the low back, right on either side of the spine, to know that those muscles are being engaged. 9 times out of 10, the person will have reduced activation on the side of pain during that exercise. I should kind of note at this point too, that if you're having pain with any of these exercises, you can try to keep going into it a little bit. If it gets better, I'm totally fine with that. If it stays the same, it's a maybe. If it's getting worse, you need to stop and address this with a professional so that they can kind of help get you out of pain first. If you remember why I said these muscles shut down in the first place, it's typically due to a pain response in the body. You are not going to do any good trying to activate these muscles all day if you're having low back pain while you're trying to activate them, because that pain is reinforcing the shutdown loop in your body. It's not going to be successful. So pelvic rocking, anterior and posterior, is a great place to start. Next, I would go to hands and knees in the quadruped position. And I really like from there, because now with the transverse abdominis, we're against gravity. So as we let our belly just kind of hang down towards the table, the weight of all of our organs and our stomach allows for that belly to sag, and actually provides a little bit of resistance that when we contract the transverse abdominis and draw our stomach back up towards the spine, it gives us something to lift with that muscle. So that's a really nice way to focus in on the transverse abdominis. The other one that I really like to do in quadruped is just simply a partial bird dog hold. So again, I just said bird dogs in general are, to me, you're doing too much. You're kind of blowing past this layer. So from that quadruped position, simply just work on even one limb at a time. Picture yourself as 4 points of stability with your hands and knees, and you're gonna try to move that like you're a table, right? You're 4 legs of a table. Try to remove one leg of the table without moving the table at all. So go really slow, and it could be a hand or a leg, and just sort of work yourself around in a circle one way and a circle the other, slowly removing one limb at a time, holding for about 5 seconds, and then replacing it without shifting away from the side that you just moved up at all. That actually then requires your stability layer to make up for the loss of stability that you just created by removing that point of contact. Then when you get to a partial bird dog hole, you would remove opposite hand and opposite leg, but instead of reaching them all the way out the way we typically do in a bird dog, you simply just sit there and let them hover just slightly off the ground for about 10 seconds before alternating to the other side. That requires more activity, and it's more difficult on your stability layer versus going all the way out to the end ranges where the glute and lat can become more active, and they help you stabilize. So if we're wanting to move that if we're wanting to use that stabilizing layer, the movements actually need to be very, very small and subtle, and then we need to work on the hold times and increasing the duration of our holds to make the demand more significant for that layer. All right, guys, that's pretty much all the time I have for this one. So hopefully that was kind of helpful. It gets you thinking about different things that we can be working on in the low back. These exercises, to be honest, it's probably the most misunderstood component of really addressing chronic low back pain or long-term back pain and overall low back health. I'm a big believer, just like we sort of brush our teeth every day to prevent cavities, and we have oral hygiene, we need to kind of be working on our own orthopedic hygiene program. And these lumbar stability exercises are top of the list for that in terms of maintaining overall musculoskeletal health. So I really hope, if you have any questions, please send them in. I'm happy to go over these exercises in more detail. At some point or another, I've made videos of all of them, so feel free to go back through our channel and look for those, or send me a DM and I'll try to send it specifically to you. I really appreciate you watching and hope you have a great week. Thank you.